Hello, everyone. My name is Amanda Stolnick. Thank you for joining me today as we explore an important and often challenging topic, parenting children with behavioral disorders. My goal today is to provide a comprehensive overview of how parents can effectively manage these behaviors using applied behavioral analysis and other behavioral strategies. We're also going to discuss the importance of parents training, building a supportive network, and tailoring interventions to each child's unique needs. So let's begin by discussing the types of behavioral disorders that are most commonly observed in children. These include attention deficit or hyperactivity disorder, ADHD, oppositional defiant disorder, ODD, and autism spectrum disorder, ASD. These disorders are all characterized by different behavioral patterns, but what they share is the significant impact they have on a child's ability to function in typical environments like school and at home and social situations. ADHD is one of the most common behavioral disorders in children. It's characterized by symptoms such as inattention, hyperactivity, and impulsivity. Children with ADHD often have difficulty staying focused on tasks, following through on instructions, and sitting still. ODD is characterized by a pattern of angry or irritable mood, argumentative behavior, and vindictiveness. Children with ODD tend to argue with authority figures, defy rules, and intentionally annoy others. ASD is a neurodevelopmental condition that affects communication, social interactions, and behavior. Children with ASD may have difficulty understanding social cues, communicating effectively, and engaging in play with others. And last but not least, the conduct disorder. It's another behavioral disorder. Unlike the disorders we previously discussed, CD is typically more severe and is marked by a consistent pattern of behavior that violates the basic rights of others or societal norms and rules. Behavioral disorders like ADHD, ODD, ASD, or CD are complex and multifaceted, with research showing that a combination of genetic, environmental, and neurobiological factors contribute to their development. So let's dive a little bit deeper into some of these factors. Genetics factors. First, we have genetic factors. Research indicates that genetics play a significant role in the development of behavior disorders. Many children who develop ADHD, ASD, or ODD have a family history of these disorders. Next, I want to talk about the environmental influences, which can also play a crucial role in shaping a child's behavior and development. Parenting styles are also an environmental factor. How parents discipline and interact with their children can either promote healthy behavior or contribute to development of behavioral disorders. Inconsistent discipline, harsh punishment, or a lack of structure at the home can increase the likelihood of conditions like ODD or conduct disorder. Now I want to talk a little bit about neurobiological factors, which refer to the irregularities in the brain structure and functions that are linked to behavioral disorders. For disorders like ADHD, ODD, and ASD, brain imaging studies have shown the differences in brain connectivity play and role in behavior. In ADHD, for example, irregularities in areas of the brain associated with attention and impulse control are commonly observed. Although genetic and environmental factors play a significant role, early intervention has been proven to be a key to reducing the impact of these influences on a child's behavior. Even when a child has a genetic predisposition to a behavioral disorder, early intervention can make significant difference. Behavior management strategies, therapy, and social skills with training can help children develop coping mechanisms and learn how to manage their emotions and actions. In this slide, we're going to dive into effective behavioral strategies for parents of children with behavioral disorders. These strategies help promote positive behavior, reduce challenging behaviors, and create a supportive home environment. So let's begin with positive reinforcement. One of the most effective strategies for encouraging desired behaviors is positive reinforcement. Positive reinforcement involves rewarding good behavior, to increase the likelihood of that behavior occurring again in the future. This can include verbal praise, tokens, extra playtime, or other rewards that are meaningful to the child. Next, we have setting clear expectations and consistent consequences. Children with behavioral disorders like ADHD or ODD often struggle with understanding what is expected of them and the consequences of those actions. Parents can address this by setting clear expectations for behavior and consistently following through with the appropriate consequences. The third strategy is modeling appropriate behavior. Children learn a lot through observation, especially in their early years. This means that parents need to set a good example by modeling the behaviors they want to see in their children. Finally, using structured routines and schedules is an essential strategy for managing behavioral disorders, especially for children with ADHD and ASD. Children with behavioral disorders often thrive in a predictable environment. Having a clear, structured routine for daily activities helps reduce anxiety and uncertainty. It also ensures that children understand what is expected of them at different times throughout the day. So in this slide, we're going to explore the crucial role of parent training and the support networks that are essential for managing children with behavioral disorders. Parenting children with challenging behaviors, such as those with ADHD, ODD, or ASD, can be emotionally and physically demanding. And that's why training and support are key components to helping parents successfully navigate these challenges. Parent training programs are designed to equip parents with the skills they need to manage their child's behavior effectively. In combination with robust support systems, these programs can help create lasting positive outcomes for both their children and their families. An essential part of the parenting training is learning how to effectively manage challenging behaviors. Children with behavioral disorders often engage in disruptive behaviors like aggression, defiance, or withdrawal. Parent training programs help teach parents how to manage these behaviors by building essential skills. To summarize, parent training programs are essential for equipping parents with the skills needed to manage their child's challenging behaviors, while support networks provide the emotional and practical support that the parents need to be successful. By combining these resources, parents can reduce their stress, improve their child's behavior, and foster a more positive family environment. As we conclude, I want to revisit some of the key takeaways from today's presentation. Throughout this talk, we've discussed the importance of the important role parents play as primary agents in managing their child's behavior disorder. Parents have the unique opportunity to make a significant impact on their child's behavior by consistently applying evidence-based strategies, such as positive reinforcement, structured routines, and clear expectations. However, it's also important to acknowledge that parents can't do this all alone. It's crucial for parents to seek professional support and guidance to enhance their skills and ensuring that they're using more effective interventions for their child. I encourage all of the parents here to actively seek professional support, whether it's a therapist, a behavior analyst, or a parent training program. There are experts who can guide you through the process of managing your child's behavior in a way that is both effective and compassionate. In closing, your role as a parent is invaluable in shaping your children's future. And by seeking the right resources and training, you can help them navigate the challenges and help them thrive in life. Thank you for your time.